Happy Wellness Wednesdays. We're back. We had a little short holiday and now we're back, and lots of things have changed in the time that we saw you last. And so we're here to join Keith Berkowitz with us today. And Keith and I are going to talk about something super important. We've talked about it before. We started talking about it at the beginning of the pandemic. Hello, Keith.
Hey, how are you? Happy Wednesday.
Happy Wednesday. And it's going to be Happy Thanksgiving soon. I'm very excited.
Yes.
To eat a whole turkey all by myself.
Well, you're trying to raise serotonin and tryptophan levels. You know that, right?
Right.
So make your house so much more happy.
Exactly. So, Keith, we're here to talk about COVID-19, of course. Why don't you give us the latest and the greatest of what's sort of going on?
So, unfortunately, as you've been seeing, cases are on the rise. A couple days ago, it was over 200,000 in the U.S., and will continue to climb pretty rapidly. What was interesting, I think they showed on 60 Minutes this week, they talked about this concept of what we call long haulers. So people that have gotten COVID, but actually still feel sick afterwards. And for months, even later, people that even gotten sick in March and April, and now we're here in November, still don't feel right.
Right.
And I think that's one of the things we're struggling with. And and we're going to talk about today why that's happening and what are some things we can do about it as well.
Right, because there's risk factors for this. You know, people who are overweight have more fat cells, have more damage to the endothelial lining. These viruses, you know, they have like these claws, and they catch on to the ACE2 receptor where there's endothelial tissue and fat tissue. And the more of it you have, the more attaching that virus can do. So it's something we can do right now to, you know, get ourselves prepared for this if we are exposed to COVID-19.
Right. There's some you know how I like data and figures and numbers. So
Love it.
There was one interesting figure that the CDC came out with. They talked about people who had been sick and those who had symptoms afterwards. And these are not even people in the hospital. They found about 35%, 1 out of 3 people actually had symptoms weeks afterwards where they just did not feel right. You know, whether it's fatigue, people had trouble breathing, aches and pains, you know, all those things happening. And when it came to the hospital, that number went up much, much higher, where people, you know, could be as high as 80% or more had symptoms afterwards, just really never fully recovered after the bout with COVID, which is so interesting because when you look at things like influenza, people have the flu, 2 weeks later, they're fine. And, you know, so the question is, and we'll talk about this today, is, you know, it's initially a viral syndrome, a viralness, but then it morphs into this inflammatory cascade. And it's that ongoing inflammation that really causes the damage long term.
So let's walk through this scenario. Somebody gets a virus, you know, we know it's aerosol, okay? It takes them, 2 to 5 days to have any symptoms. And then what happens?
So what's interesting, so the 2 to 5 days comes about because that's when really viral load starts to rise and when people are most infectious. Actually, it's 2 days before they have symptoms and really the first 6 days after that. So over that kind of 8-day period, you'll see the viral loads rise. Typically when people have a high fever, things like that, that shows you even a higher viral load, right? One of the responses to fever is your body responding to this virus, this inanimate object, which I always laugh about, right? I mean, it's crazy.
So tiny and it's not even alive.
Exactly. And so what happens is, that's really the viral phase. That's very typical to what people see with things like influenza. They have chills, malaise, fatigue, sweats. You can have diarrhea. One thing that is so interesting is loss of smell, right? That's so typical for COVID, which we really haven't seen too often before. You know, and again, then what happens around day 7 to 8, that's when the inflammation takes over. And that really, in a large way, is a different disease, right? You treat viruses one way, but then you treat inflammation the other way. Ironically, for severe inflammatory syndromes, they give steroids, where you don't want to give steroids in the viral load phase. So the treatment almost is the opposite. And it's really that day 8 to day 14 where really people turn for the worse. And one of the big things they develop is that's where they develop the respiratory symptoms, what we call hypoxia with low oxygen, trouble breathing. that's when they call that, you know, the famous now term cytokine storm or inflammatory storm starts to happen. And that's typically when people end up being hospitalized. It's really in that second week, that day 7 or 8, that you start seeing people go to the hospital.
Now, most people that are carrying the virus are walking around asymptomatic.
Absolutely.
How does that, and it could be like when any of the other coronaviruses, right? You know, some people catch the common cold, some people don't.
And there was one interesting study, I think we talked about this before, that people said that the way we deal with the common cold seems to be the same way we deal with coronavirus 19. So the people that really recovered quickly from a common cold also seem to recovering much quicker in general from COVID-19, that it really behaves very similarly away. And maybe our immune system is primed to some reason from that. It's a, you know, strong possibility.
Absolutely. And what about, you know, what do we do about asthmatics? Because there's been a lot of mixed research around them.
It's so interesting. I heard that in some ways that it's worse, in some ways it's better. So here's what's interesting. So again, people with underlying respiratory, you know, symptoms would also they would be exacerbated by some kind of virus, typically with influenza, for example. But in some cases, and it may be what they're taking from an inhaler standpoint, may have some protection, right? There was a study on something called some of the inhaled steroids that can be used. And early on, before we really knew a lot about it, in the second week, I actually put someone back on the inhaled steroid, and it actually tremendously helped with their, you know, oxygen saturation. So it's still not clear whether it's worse for asthmatics or it's better. Typically, influenza, clearly always worse. COVID-19, not so clear.
Very strange little creature this is, non-living creature.
It needs to go back. Go back where you came from.
Exactly. So we have fatigue, we have trouble breathing, we have aches and pains, loss of smell. Some people feel just tired. Some of the symptoms are just, you know, days of fatigue, and then they wipe it out. Are they still infectious for up to 10 days? Because this is the debate right now. They're trying to look at to see if they can lower the quarantine time from 14 days to 10 days.
So what's interesting,
how long is someone infectious?
So if you look at like the PCR testing, which is the nasal swab testing for positivity, it's really the highest around day 6 or 7. So the question is, does that actually mean that you're still infectious? It's really not clear, because you're having, you know, a response, but are you able to pass it? I think clearly people really think the first week for sure, for the first 7 days. And I think for people that have been sick, really quarantine's probably 10 days now, you know, after they have a positive test.
Danielle Stern, she's my favorite person. She's asking a question, the post-viral lingering symptoms. Absolutely. We're going to be that's one of the whole point of this conversation is this post-COVID inflammatory response that people are getting. And I find it's, you know, it's similar in patients that have autoimmune conditions, who have had Epstein-Barr virus, cytomegalovirus. It's these viruses, never well since a virus, that triggers this whole inflammatory cascade in your body that has a lingering effect. And there's a lot you can do about this to help sort of get your body back into track. And the thing is you really need to work on it. It's like you're building your body's muscle from scratch, if you want to think of it. It's just like muscle building, your immune system supporting through this time.
I think that's so important that you said, because we think of chronic fatigue syndrome, and a lot of research on chronic fatigue syndrome shows the underlying viruses, the Epstein-Barr virus, human herpes 6 virus, cytomegalovirus, mycoplasma pneumonia, although it's not a virus, it's small bacteria, all can be definitely involved with that. And I think what's interesting, the same characteristics I see in chronic fatigue syndrome, I'm really seeing in these sick post-COVID patients very clearly. And two of the things that are really interesting to me is, and the things I'm seeing over and over again, is in some people elevated inflammatory markers, but actually in most of them, no. Ironically, when we do things like C-reactive protein and ferritin, which can be high in early inflammatory phase, I'm not seeing that a lot, interesting enough. So they still have this inflammation, but the markers we use for inflammation are not positive. The other thing that's so interesting, they tend to have low serum vitamin C levels, which is really fascinating. So there you go.
I think in most patients that are positive for COVID who have poor outcomes had low vitamin C levels.
Yeah, and actually they did a study at one of my colleagues at Hospital for Special Surgery. He actually measured vitamin C levels in the floor patients who hospitalized, and almost all of them had low vitamin C levels, and that's really clear. The other one that's really interesting and is blood sugar dysregulation that I see. It's really fascinating that people have not necessarily high blood sugar, but they have low blood sugar. You know, this is something we see sometimes in chronic Lyme patients as well, or even see in HIV/AIDS patients too. So they have this blood sugar dysregulation. They get fatigued. They get what I call orthostatic hypotension, where they have trouble holding onto fluid. They're always dehydrated, and that leads to a lot of the lightheadedness, malaise, muscle pain. You know, that goes along with that.
It's interesting because we take vitamin C. Some people take it. They take it in ascorbic acid form. It's the name of a vitamin C, the medical term name of vitamin C, as you doctors like to call it, the conventional docs. And it's super important because the absorbability is the issue with vitamin C. It's a water-soluble vitamin, so it's very hard to absorb ascorbic acid. Just regular vitamin C, you probably absorb, what, 20% of it?
Exactly, and 80% goes to your colon. Basically, if you need something to help you go to the bathroom, there you have it. It's vitamin C. and it's interesting. So, and again, to get levels where it's actually therapeutic, and we know, we talked about earlier, this group I work with, we call Math Plus protocol.
Yes.
They're giving doses in about 6 grams a day intravenously in the ICU, and you're taking orally, you're probably getting a fraction of that. Say you take 1,000 milligrams, you're probably only getting 200 milligrams. So you think about, and people cannot so easily take 6 grams or more orally because, they'll be in the bathroom all day. So,
exactly.
So it's interesting. So that, and again, it has the other aspect is we learn in the hospital, they give it every 6 hours. And the reason they do that is, like you were saying before, it doesn't really stay in your system a very long time. And that's a problem. So you really lose it pretty quickly. And again, we know humans, bats, primates, guinea pigs, vitamin C is not made by us.
No.
Unlike your beautiful dog, very lucky.
Oh, Dante, did you hear that? He's out there sunbathing right now, of course. It's all he does all day. And he's getting his vitamin D right now. So, yeah, and that's why I made, and I'm going to brag about this, I made this vitamin C cocktail because it's got the liposomal vitamin C. It's got zinc as well in there. We have superberry antioxidants for, oxidative stress, because we're exposed to any oxidative stress all the time.
And that's such an important anti-inflammatory, right? So we're talking about inflammation. That's the key. And what said Nigma, that liposomal about 90% gets absorbed. That's a big difference. You go from 20% to almost 90%.
It's like I'm giving myself an IV with my vitamin C.
See, what people don't realize is that our cells have what we call a lipid layer. So they have a fat layer. So actually, fat-based components cross that much easier than non-fat-based components.
Absolutely. Now, what is the deal? I mean, I understand the deal with vitamin D, but let's explain it to everybody listening right now, because we are hearing vitamin D over and over again. And you and I have always looked at our patients with vitamin D deficiency, and we've seen hormonal issues. We've seen frequent infections with low vitamin D. We've seen osteopenia. We've seen, every inflammatory disease you can name, one of the underlying causes is vitamin D deficiency. Number one, why are we all so deficient in vitamin D? And, what is the reasoning behind it? And why do we now need it more than ever? I'm going to take it. Right now.
Okay, so there we go. I love when you have an example, right? It's like show and tell. So that was my favorite part of school, by the way. And
Mine
so
too.
what's interesting about vitamin D, it's one of those we call fat-soluble vitamins, vitamin A, D, E, and K. So the problem with that is they're much harder to absorb. And that's a challenge. So, and again, what's so important is that you always need to take something with fat that's fat-soluble. So that's
I've just
why,
eaten, by the way.
And so important. And what's interesting, I don't know if you heard this one. I heard a story about the sun and the relationship. Someone, and I have to find where I read this article, that our chronic exposure to fluorescent lighting affects our ability to absorb vitamin D from the sun. Have you heard that?
Yes.
Before?
Absolutely.
So that we don't absorb because our body no longer can, handle it because of the change in the lighting we're exposed to. as
UV
both of
lights.
us are exposed
Yes.
to right now.
Yeah.
We should do it next time outside, so it's better.
Actually, I have no lights on in. This is, except for the light behind me, but this is all natural lighting coming from outside.
Oh, see, look at that. Vitamin D.
I've got the California thing going on here. Nice and sunny. Got Dante sunbathing.
So, and what's interesting, and we talked about this before, about 80 to 85% of people are low. It's probably even higher than that, because typically, and we do this blood test, which we measure vitamin D 25-OH, and the normal levels of 30 to 100. We're probably finding more clearly people need to be closer to 60. That 30 probably is still deficient. And,
absolutely.
And if you're following COVID-19, you see every day there's something about vitamin D. Normal vitamin D levels, and I like that 60 number, decrease risk of getting the virus by over 50%. That alone is tremendous. And one of the reasons, and you started mentioning this before, vitamin D works on what we call an ACE2 level. And we said this before, it's good to be a woman in this case. Women have better levels than men, and that's why women have lower mortality rates from COVID-19. So the virus says to the ACE2 level, I'm catching a ride to get into the cell. So vitamin D is actually able to stop that, and that's one of the benefits. And it's through part of a system we call renin-angiotensin. It's how the kidneys actually regulate blood pressure. Anyone who takes blood pressure pills, those most common blood pressure pills actually work on that system. And that's the system actually where, COVID-19 gets through, but also is so vitamin D dependent. What's interesting is now there's studies showing that vitamin D actually may be a blood pressure pill. That good vitamin D levels may help regulate your blood pressure much better. And on the other hand, from the inflammatory immune system, you cannot regulate your immune system without vitamin D. And inflammation is a big issue. What's interesting, CRP we talk about with C-reactive protein, one of our biggest measures of inflammation, really can be lowered in part by using vitamin D. Vitamin D is one of the elements that's so critical for bringing that back to its baseline normal level.
Absolutely. And also in darker skinned people, and we mentioned this, a couple weeks ago, that in people that are darker skinned are going to have a more susceptibility to lower vitamin D as
Absolutely.
well.
And actually, if you look at the mortality rates, right, we see it's much, much higher in Black and Hispanic community than almost any other. And again, also, we talked about the other big risk factor is diabetes. So people with diabetes are really getting much worse results and outcomes from this virus.
So people who are having lingering symptoms, the one thing I would do, I'm going to talk about the diet aspect, and then I'm going to let you take it from there, is the diet is a foundation. Okay, if you and I are building our house, if our house's foundation isn't strong, no amount of vitamin supplements you take or anything you do is going to support that. So you need nutrients, you need proteins, you need good fats, you need good carbohydrates, you need rainbow vegetables. Now, when I mean a rainbow of vegetables, having them steamed, because steamed vegetables actually increase the nutrients, and it also helps your digestion break it down better, because we know our digestion is like a machine. It starts off in your mouth where you break down your carbs, your amylase breaks down into simple sugars, then it goes into the esophagus, the duodenum, all of with the stomach acid. The stomach acid then needs to break down the protein into amino acids, increase intrinsic factor, annihilate from bad bacteria. There's a whole process that happens when you eat something. So being mindful of what you're eating and you're chewing, the starting of the digestion starts in your mouth. So any of you guys that are out there that are quick eaters, that gobble the food down and don't chew it, you're not helping your immune system, because your immune system needs to be able to help you digest that food, because your gut is the biggest part of your immune system in your body.
It's almost interesting. I like the gut, like the beneficial bacteria is almost like that sentry outside guarding the entrance, right? So again, that's your first line. Exactly. So that's it. And again, actually, there's even now studies looking at probiotic levels and viruses, right? We know not having proper probiotic levels and beneficial bacteria, your body doesn't absorb fat properly, and without absorbing fat, making a lot of your immune cells, which are fat-based neurotransmitters, your body really cannot function optimally without that. So that's like, I like that as almost like step 0, right? Even pre-step 1 to beneficial health.
Well, your gut lining is like one cell. That's like paper thin. It's like this paper. It's like one cell. And so it's kind of a paradox in the sense that stuff can go into it and stuff can come out of it. You know, like if there's perforations in the intestinal mucosa, you can get something called leaky gut. And, you know, that leaky gut can cause food intolerances, can cause bloating, gas, immune system. So we want to start with the diet. For all of you long-term sufferers with this, really super important to get your diet really, really, really on track, get your blood sugar levels optimized, because part of the fatigue is the dropping of the blood sugar, as you were talking about before, Keith. Because I think there's something that happens with insulin resistance with this particular virus, with the cytokine storm. It makes sense.
And again, insulin is one of the big factors remember, insulin is what helps glucose get into a cell, is one of the most evil inflammatory factors in our body. We want some, but we want not too much, because that leads to a lot of poor outcomes and a lot of diseases.
Exactly. Okay. So people who have this ongoing, I talked about diet, we talked about vitamin C, we talked about vitamin D. You want to up those two. You want to take, between, 2,000 to 5,000 IUs of vitamin D a day, depending on what your doctor prescribed. And again, not all vitamin D is created equal. You need to have K2 with it, vitamin K2, because you're going to increase the absorption of the vitamin D, and you're going to also help the integrity of the vitamin D staying around. Otherwise, you lose that absorption.
And remember, vitamin K also, endothelial function, which you talked about before, so critical. Yes. Vitamin K and as well as vitamin C are really critical components of that.
Huge, huge, huge. So what else besides C, D, and K?
So I would use also omega-3s. Remember, those are a telltale anti-inflammatory. So yeah. Did you go reach for some? Is that what it is?
I went to get the dog.
So omega-3s, again, we know, fish oils are very anti-inflammatory, omega-3 based. The other one is interesting, turmeric or curcumin, another very strong anti-inflammatory. I know this is your favorite one, methylation. So B12 and folic acid, really critical. Methylation has such a big role on our body's ability to detox, to get rid of substances that shouldn't be there. And so what's interesting, the other thing I've kind of looked at is more from a chronic fatigue standpoint, which is mitochondrial, we call mitochondrial function. And one of the big factors in mitochondria is kind of the engine in the cell is the Krebs cycle. So Krebs cycle is how your body makes energy, we call ATP. So two of those components are actually CoQ10, coenzyme Q10, and NADH. So those both help on energy production. So that really is critical, especially when people are having this overwhelming fatigue. It helps the body actually stimulate to make much more. The other one that's really kind of interesting is L-carnitine. L-carnitine also has an effect, so we use that a lot. It helps fatty acids get into the mitochondria, so that's really important as to make substrates and make a lot of these other chemicals we use. Really critical. DHEA is the interesting one, right? So, and again, that's one we want to be careful with hormone sensitivity. But DHEA often will go low because cortisol is high, and that will affect hormone production. Remember, when we're in a stress state, which I think a virus would be qualify, right? Very clearly. Cortisol is going to be high, and the body says, okay, I'm making cortisol. Progesterone is going to work on cortisol. Forget your hormones. DHEA, estrogen, testosterone, progesterone will all go down. So that's also important to rebalance it. Exactly. It's all about balance at the end of the day. And again, we talked about vitamin C. I learned something interesting. Vitamin C is actually needed for carnitine. So you can't actually utilize carnitine without vitamin C. Actually, you can't even make cortisol without vitamin C. That's the other part of it. So it's really critical. The one that's kind of interesting, which is kind of a drug that's come in favor lately, is something called low-dose naltrexone. So I don't know if people have heard of naltrexone. Naltrexone's famous. It's an anti-opioid. It's something that when people have opioid addiction and want to get off of it, it's one thing that helps the liver block opioid receptors. What it turns out, and that's in very small doses, it actually seems to be an inflammation blocker, that it's able to block some of the cytokines that are involved in inflammation. And there's been a lot of research looking at chronic fatigue syndrome and fibromyalgia, which I think this post-COVID kind of, mimics a little bit, and using that to block some of the pain receptors in that and some of the inflammatory receptors. And it's really shown really good data. It's pretty well tolerated. One of the only side effects we see is insomnia, which often can be regulated by taking the medication earlier. And the doses are probably 10% or lower of what you would do to block opioids. But it's really interesting. I've actually seen one patient for post-COVID use it who had really bad headaches, and they've started to resolve after 3 to 4 months.
Oh, excellent. Yeah, and that makes sense because it's working on shutting down that inflammatory cascade that continues on after post-viral. So it's like the viral haul.
And I think that's so critical. I mean, I think that's where I think people get confused. If you're focusing on treating the virus 2 to 3 months later, that's really late. The virus has already come and gone. It's done its damage. Now we're treating the damage, which is really the inflammation. So a lot of the medications that have been out there already really focus on as an antiviral. That's really no longer effective after really the first 2 weeks of the disease. And then you have to really switch to the inflammatory problem.
I've used L-carnitine as well to help people with insulin resistance and weight loss, and it's absolutely brilliant in doing that as well.
The only caveat with L-carnitine, you got to be careful if you're on thyroid medication. So that's the only thing. So you don't want to take, could affect conversion to T4 to T3, as we've talked a lot about before.
Yes. That lovely conversion, that thyroid problem that every single person seems to have.
Oh my God, same things come up over and over again. Isn't it so fascinating?
It's fascinating how a majority of patients these days, when you check their thyroid, something is wrong with their thyroid. Now, I feel like any of those that are having people with having COVID, long-term COVID symptoms and who have an underactive thyroid need to adjust their thyroid dose, okay? Because there's definitely some inflammation taking place there. There could be some underlying autoimmune working out, and that can all be fixed. Keith, I've seen it with diet. People change their diet, can massively impact their thyroid. So diet is going to be our foundation to everything. So we talked about DHEA.
Actually, you brought a great point up, and I want to bring it up, talk about it. So you talked about autoimmune. That's really interesting. So you could have an underlying autoimmune disease that's kind of been quiet for a long time, and COVID may be triggering that. That's where we see
it out.
Exactly. And I think that's really so critical that's why you want to kind of look at and do a really full workup to say maybe there's always been an underlying problem. You've been able to handle it, and all of a sudden post-COVID, it put a lot of stress on your body. Then this underlying autoimmune or other condition does pop out underneath.
Absolutely. Somebody's asking a question on thoughts on DIM. And guys, put your question in the question box so I can raise the question for everybody to see. What are your thoughts on DIM for estrogenic toxins? Really good question. I've been using DIM in practice for 20 years now. And the DIM is basically like eating tons and tons of broccoli and cabbage. It's from the cruciferous family. And what it does is it helps balance these two different types of estrogen, 2 to 16 hydroxy ratio. And it helps sort of lower the kind of dirty hormones in the body, so to speak. I like to always mix DIM with milk thistle because milk thistle increases the amount of glutathione production. And, DIM taken alone, I think is okay, but great with glutathione or with milk thistle.
And that's a great point because, again, it's nice to lower the level, but you have to get rid of it. And that's where the glutathione and milk thistle really works effectively.
I mean, think of your liver as a packaging center, right? It's kind of like Lucy in the cake factory. One person's packing it, putting it away, throwing it out. One person's waiting in the line to be put in a box. There's different sort of things that happen that your liver does during detoxification. It's actually very, very interesting what the liver does and how fascinating that organ is. So, it's super important to even focus on the liver, even if you're having post-COVID symptoms. The other thing somebody asked, Keith, was quercetin.
Oh, that's an interesting one. So quercetin, and we've actually looked at this really carefully. Quercetin is really interesting. It's actually been long studied as an antiviral. So where we're studied is actually in HIV and hepatitis C. So it actually prevents the virus from assembling. So actually in COVID-19, it's actually shown to be work. And we also use that as part of a preventive protocol. Very important. And I might as well mention the other ones part of that. So the other parts of that preventive protocol look at vitamin D. We talked about vitamin C, really critical. Melatonin, which is the interesting one. we're looking more and more about melatonin. We know melatonin helps sleep, lowers cortisol, but it also increases what we call innate immunity, your body's ability to make an immune response, really critical. And zinc, which is a natural antiviral, typically for RNA. COVID-19 is an RNA virus, so that works. And the other one we talked about, what we're looking at, is a drug called Ivermectin, which, do you give this to Dante? We talked, it's a drug that's used a lot in dogs for worms, and that may have antiviral effect. We talked about this last time, that in vitro, which means cell studies, it shows about, and within 24 to 48 hours, 99.8% of the virus being killed. Actually, they've used it now in Peru, Brazil, Argentina, where they've seen a dramatic drop in mortality rates from COVID-19.
It's very promising, and I'm just wondering, why aren't we hearing about it in the media yet? Is it still under trials, or?
I mean, we're starting to see the first, what we call RCTs, which are randomized control trials. Interesting enough, they're coming out of Egypt. So, and now we're starting, and there's some trials in the US starting to come out. So, and it's really interesting drug that's actually had over 4 billion doses distributed over the last 20 years. So it has a really pretty safe profile. It was used for river blindness in Africa. That's one of its major uses. So they're actually looking at it now. There's a study in France they're working on, looking at COVID-19 right now. And there's a study in Florida that they're looking as well.
Is it not something somebody can use who have had COVID already for long term?
See, that's not what's not clear yet, if we know that. Where they're really looking at more for is actually early treatment, but interesting enough, prophylaxis. So to prevent, and one of the studies I've read, which was out of Iraq, of all places, interesting enough, is they actually gave it to about 220 patients, and they gave it to the family members of people who were infected. And so the control group, about 60, almost 58% of them got COVID-19. In the group that got ivermectin, only 7% got COVID-19. So that really shows a lot of promise.
It feels like it interrupts something to do with the RNA.
Correct. And actually, what's interesting, it was previously studied in Zika and influenza. So this has been studied before in other viruses to look at it. It's kind of interesting. I think a lot of these parasite-type illnesses really behave similar to a lot of these viruses, and I think we're learning more and more of that.
Yeah. We've got a question. My son had fever, difficulty breathing and swallowing, headaches, 2 negative COVID tests.
First of all, which COVID test? Was it a rapid test or a PCR test? So actually, this week I went through this. A patient called me Saturday night while I was relaxing and goes, I have a positive test. And I'm like, wait a second, you had it in March. We just tested antibodies in September. What do you mean positive test? So it turned out she got the PCR as well as the rapid, that there's a lot of false positives in the rapid test. So the problem with the PCR test, again, it's the day when you get tested. We talked about when around day 6 to 8, you may get up to a rate of 80%. So if you're day 2, 3, and 4, you may still get a negative test. And I've seen even in hospitalized patients where the 5th, 6th, or 7th test is positive. So it does depend on viral load, and the testing still is not 100%. But I think
every day is a new day with this virus. You just, you can't just take a test and go, okay, I'm negative, I'm going to go out and,
So what I've decided in practice is actually I'll treat. So I'll treat as if COVID-19, because I think you want to really prevent that inflammatory phase. So if you're not positive to day 7 or 8, that's already when inflammation takes over. You really want to address some of those factors earlier.
There's a new test out that is testing for influenza and COVID-19. So it's a combination panel so that it rules out what you have.
So I think what's good about influenza, hopefully this holds true, is in South America, the cases were pretty low this season. So I think the social distancing, and we could talk about what China's done, which is so interesting.
Yes,
and they have much better response. That social distancing and masks have really decreased the spread of influenza dramatically. It went down tremendously this year.
I think what's happening is people are sick of hearing that word, social distancing and wear a mask. I think we need to explain why these things are important, because it just feels like a cartoon in a way, because people are not really understanding we're following countries like China that have done a great job at keeping this at bay. That's because they're social distancing, they're wearing masks. Those are I think the two most important things.
And remember, China was hit hard really early. But what's interesting, if you look at their mortality or death rates, it's 1/100th of the U.S. So this is a little, older data, where per million we were having 340 deaths. China was like 3. I mean, it was and they really stick by the contact tracing. They use apps on their phones, which are really effective. But they really, and you've seen this over the years, they're very good. They're taught well in this way to wear a mask, to social distance, to really stay indoors, to do those things, to stay away. And they really were able to in most cases, keep the virus localized within that one province.
I'm going to throw you off right now. What do you think of the flu shot?
Oh my God. You're really putting me on the spot, aren't you? I don't know. I'm not sure. What's so interesting, it's a tough one because, again, if you look at the efficacy over the last couple of years, it's been up to 30%. And again, we don't know if it's a risk or not. The data from the previous virus we dealt with, which was H1N1, the swine flu, was really mixed, actually. In Canada, they saw actually that the influenza vaccine may have increased the risk of swine flu. So it's really not clear a flu shot. And I think people should really look at it from a risk perspective. Obviously, higher risk people need to protect themselves. Again, those are your respiratorily compromised or heart or cancer. So I think, but the good thing about it is, again, you were talking about social distancing, masks. That's also going to stop a lot of the spread of influenza as well, right? I mean, that's the beauty of it. So you're actually working on other viruses from the same aspect.
Now, if somebody has a question, or if you have a couple of negative tests, COVID tests, that you have the symptoms, do you have COVID or not? Just because you've had a negative COVID test and you have the symptoms, I mean, the symptoms could be, anything. Obviously, if you're having the main symptoms of loss of smell, you're having fever, you're feeling unwell, just rule out that you have it and stay home. Take your vitamin D, take your vitamin C, eat extremely healthy, rest, lie in bed, watch a couple movies, and just stay at home and get better at home. That's going to be your best bet.
I mean, diagnosis is a challenge. I mean, I've seen, even from the antibody perspective, people be negative. They had an episode in March, very clear.
Yeah.
April, May, antibodies are negative. June, they're positive. Then in August, they're negative again. So, I mean, I think you have to be really careful dismissing it because it can be, that aggressive. I think you have to really be pretty sure that you don't have it, especially if you're symptomatic.
Yeah, it's a novel virus. Everybody's learning about it. Everybody's new to this. So I think your best bet is to just stay indoors and hang out with your little furry creature if you have one. And, just, stay home, lie in bed, and, just read a book, watch some shows, and stay away from the news. Because that will get your cortisol revved up, and that will suppress your.
Remember, think about the best expert is less than a year, right? If you think about it, the one who probably knows the most is less than a year. So I mean, this is really, we're learning as we go, and this is so different than a lot of the things we dealt with before, and that's where the challenge has been.
In a weird way, I feel like this is a wake-up call to the world, to really, take care of your own health, and take care of your body, because your body will take care of you.
Oh, it's so true.
Right? It'll just keep opportunistic things out. It's kind of like people going out for dinner and eating the same meal, sharing the same meal, and one person gets food poisoning, the other person doesn't. Why does that happen? Maybe that other person had more hydrochloric acid in their stomach and had better digestion and was able to kill off what was in there. So again, I think it's super important in that respect.
And I think, I'm sorry to interrupt, but that's where blood sugar, we talk so much, if you look at the mortality, it's so tied to blood sugar. Yeah. The diabetics, really, they had more inflammation, more fatty liver. That is so critical. So if anything you can fix, and you said this before, fix your digestion, get your blood sugar regulated. Those are so key to anything, and especially in this day and age with this pandemic going on.
Right. Can you talk about turkey and its benefits to the immune system and the feel-good neurotransmitters in your brain?
So it should be turkey soup, right? We talked about chicken
Yes.
soup. We should have turkey soup.
Yes, let's talk about it.
So again, so the famous, after dinner snooze, right after turkey dinner, right? The tryptophan and serotonin. So that's, but again, remember, you want to use serotonin. You need to have your probiotics, your digestion right, because remember, serotonin comes from the digestive tract.
Yes.
So you need to have that in, but turkey definitely has those benefits. Again, I personally like the darker meat because it has a little more fat, so that it balances my blood sugar better, but that's really key. And what's interesting, and I don't know if you do this with your patients, I like doing soup first. I think soup is such a cool thing to do first because it primes your digestion. It gets your digestion ready before you have something heavier afterwards.
Okay.
Do you do that? Do you do that as well?
All the time.
Okay.
All the time. I think of my body like how I think of a car sometimes. Like I wouldn't just drive my body off the driveway, run out without warming it up first, right? So you got to warm the body with, things like soup. And you talked about turmeric. What I'll do is I'll take a whole chicken and I'll have it all cut up and I'll put it in some water. I'll add turmeric. I'll add lemon, ginger. You can add garlic if you want. I don't add garlic because it upsets my digestion.
Cayenne pepper?
Sorry?
Cilantro, cayenne pepper.
You can put cilantro in there, which is really good at detoxifying, pulling out the heavy metals. And you can put some pepper in there as well. And celery, carrots, any kind of vegetables you have sitting around in the fridge that are going to go bad, chop them up, put them in there. And I've got this thing, Keith, called the Ninja. I'm obsessed with it. I don't work for Ninja. This is not an ad, but I seriously put everything in there and I pressurize it. And it comes out. And I also put potatoes in there because I love potatoes. And so that whole kind of broth with the turmeric and, all the different spices, you can put whatever you want in there. It makes a gorgeous soup and you can eat it for days. I sometimes freeze it so that if I have a rainy day and I don't have food hanging around, I'll just grab it from the freezer and warm it up, and it's delicious. And it's really good for you. It's very good for your body because the turmeric is an anti-inflammatory, ginger as well. And you've got carrots for beta carotene, celery, potatoes. Oh my God, my mouth is watering. I want to make that.
So it's interesting. People should take their excess turkey and then make it into that kind of soup. That's perfect, right? So you'll have that for a while afterwards. So there's your key. Absolutely. So now you have a use for everything. Someone asked about the immune. So actually I have the protocol, which is called iMask, how appropriate for this, on the website's called COVID-19criticalcare.com.
Okay, good. Oh, yes, taking your vitamin D and beauty in a bottle. Yes. It's not only good for your immune system, but it's good for your skin. So we know our vitamins A, C, E, zinc, selenium, hyaluronic acid, that's in the beauty in bottle, super good for the immune system because we know the ACEs are super important as antioxidants and they work synergistically. And we have vitamin D as well. We talked about over and over again. Can't tell you any more about vitamin D than we've already told you. Patients literally who have taken vitamin D feel a lot better, just as in a whole.
I actually been using liposomal vitamin C every day, and my skin is so much better. I don't know if you didn't notice, but but it's made a tremendous difference.
I'm glad you're enjoying it, Keith. Okay, so and people that are listening as well, make sure you take your vitamin D with fat. With some, Keith Berkowitz. You always talk about avocado. For example. Oh,
my favorite.
Your favorite fat. And it's full of nutrients. It's full
perfect blend of fat and fiber. Perfect blend of fat and fiber.
And you can even add chili peppers to your soup. If you're brave like me, chili peppers are rich in quercetin. So you can throw some of those in the soup as well. Broccoli, as we know, is super important at detoxifying the dirty hormones out of the body. And what about things and tomatoes? I always add tomatoes in because it's super, it's just really flavorful and rich in lycopenes.
And what's interesting, the lycopene actually comes out when you cook it, which is so interesting. When it's raw, you don't get as much of that.
Right. You don't get as much. Can you take too much of C, D, and zinc? Yes, you can. C just naturally comes out of the body because it's water soluble. Keith, do you want to answer the next question? Best vitamins and minerals for perimenopause. since you're such an expert in perimenopause. Of course, we've got him on pause now. He's on his perimenopause. Keith, are you here? Okay, well, I'll answer that question. So vitamins and minerals important in perimenopause for sure, because we need vitamin A for the immune function. Oh, we lost him. He'll come back. And we need vitamin C, which is going to help the adrenal function. And we know that the adrenal function helps your overall hormones. 30% of your hormones come from your adrenal glands. We're going to get Keith back on. And so again, getting high dose of C is going to really support your adrenal glands. Minerals as well. Do you want to take over the minerals for perimenopause, Keith? You went on a pause.
Yeah, it's
you
really
go on
interesting.
perimenopause?
Andropause. It's andropause.
Andropause.
For men. So, did you say magnesium already?
Yes, because I didn't talk about the minerals. I'm going to let you go hit the minerals hard.
Magnesium is a big one. That has a big effect. It helps blood flow and also helps blood sugar. Magnesium. You have to throw them at me. I lost track. So there.
Zinc.
Okay, zinc. Oh, for immune system or for perimenopause?
For perimenopause.
So zinc is really important also for hormone production. So to regulate your hormones, very important. Magnesium. What's so interesting, I think you bring this up all the time. It's like that word, you have a concert of minerals, and they all have to be in sync and certain levels. What's interesting, for example, magnesium and calcium are counterbalanced. So if someone takes a lot of calcium, they'll have low magnesium. Really important. Potassium is another one that has a role. But if you don't have enough magnesium, potassium will also be well. And a lot of them really function on blood flow and regulating blood flow. So when blood flow is normal, our organs work better. We produce better neurotransmitters. We produce better hormone levels.
When people are going through perimenopause, what happens to us in perimenopause is you also go to the toilet often. So you pee a lot. So when you pee a lot, you're losing those important potassium, even sodium. Sodium is super important. Like people, are like, oh, low salt diet. Well, yes, low table salt diet, but Himalayan sea salts and kosher salts are super important to add to your.
What's so interesting, they did a study in Europe. When people cut out salt completely, the risk of heart disease went up.
Right.
So people forget that we call these channels, a lot of the channels, which is how cells communicate, work through sodium, magnesium, and potassium.
Absolutely. Absolutely. Do we have any more questions? Keith will send me the website and I'm going to post it on my Instagram so we can have the COVID website there. Are we missing anything, guys? Any more questions? I think we covered everything. That was really informative. I really enjoyed that.
And I want to bring one last point in. So it's really important not to be fatigued by this. And the reason why it's so important, if you look at these past epidemics, especially, let's talk about 1918, which was the Spanish flu. It's actually the Kansas City flu. It was misnamed. But what people forget is that the second wave was more deadly than the first wave. So it's so critical that even though we've been through this for such a long time, to be vigilant, because the risk is still there and it's still great.
Guys, be vigilant, be safe, have an amazing Thanksgiving. I'm looking forward to hearing all about your post-turkey soup recipe. And if you send me a good recipe, I'm going to send you some supplements. How's that? Okay, you have to post the recipe. You have to tag me. You have to tag Keith.
And it has to be that I can make it. So that's the key, right? If I can make it myself, it's simple enough that I can do it. That's beautiful. That's the key.
Keith, I've seen you in the kitchen. You're really good. Don't knock yourself. I've seen you cooking for the kids many a times. Well, thank you, Keith, always for being with me on Wellness Wednesdays. I love talking to you, and be safe, everyone, and happy Thanksgiving.
Happy Thanksgiving.
Bye.